Well, the Health Minister, Maria.caulfield, joins me now in the studio. What are you going to do to get waiting lists down?
Well, we are turning a corner. We've seen for the 5th month in a row waiting lists starting to come down, and not just the amount of people on the waiting list, but the length of time that they're waiting. On average, for a procedure or a test, it's around 18 weeks wait, but we have got people waiting up to just over a year now, but that's significantly better than it was. But it's not just our waiting lists, our A&E times are improving, our faster diagnostic standard for cancer times are improving, and access to dentists since our recovery plan published in January. We're also seeing 500 more practices signing up for NHS dentistry, which will also have an impact on dental waiting lists too. So we're starting to turn that corner, and hopefully patients will start to feel that difference.
Rishi Sunak said the public should hold him to account when he announced his target. Waiting lists are higher now than they were when he said that. So don't the public have a right to be angry?
Well, of course, and I know from my own post back as constituency MP that waiting lists are higher than we want them to be, but we are seeing that reduction in waiting times in particular, and that's despite just coming through winter, which is normally a time when waiting lists really suffer. We've also got strikes on our hands as well, and we know, say, for example, that in February, 36,000 tests could have been done if it wasn't for strike actions that would have come off that waiting list. So there are a number of factors that influence waiting times, but we are going in the right direction. And if you compare our results here in England to what Labour are doing in Wales, where they run the NHS there, they've got 40% higher waiting times on their waiting list compared to England. So it shows it's across the country, and it's not just here in England where we have problems.
I mentioned at the start of the programme that this extraordinarily low level of satisfaction, just 24% of people, by far the lowest statistic there's ever been. When you inherited this in 2010, it was 70%. You must recognise something's gone horribly wrong under your stewardship.
Well, it's called a global pandemic, and that's why, we cancel for 2 years routine procedures. That's, operations, tests, diagnostic procedures, examinations. And so people who were waiting for those tests are just getting them done now. And not just have they had to wait for that, but also they've probably become more unwell and perhaps been in pain during that time. So, of course, people are going to feel dissatisfied with that. But they should be encouraged that whether it's our waiting times for procedures, our A&E waits, our 4 and 12-hour waits in A&E, our ambulance waiting times, our dental recovery times, they're all starting to improve now. So patients will start to see that difference pretty quickly.
Also, about funding, another stat that's come out is that half people will be quite happy to pay more tax into the NHS. Higher earners are the ones who are keenest to pay more tax. Why are you giving a tax break when you should be taking more tax to fund an NHS? Well,
it's a difficult balance because people are also struggling with the cost of living, and we've seen that over the last few years with the energy prices increasing and inflation and interest rates on mortgages. So we've got to have a delicate balance, but it's not just how much you put into a system, it's what you do with that money. And our funding for the NHS is going to frontline services. So we've got those 160...
It's barely, but you... The amount of money extra you're putting in is barely scratching the surface.
Well, if you look at our...
In real terms, it's a smidgen.
But we're putting it into frontline services, and that's the difference to what we're doing to what Labour did when they were last in government. They put billions into an IT system that never saw the light of day. We're putting them into, say, our community diagnostic centres. We've got 160 sites now operating. They've delivered 7 million tests since they were opened. We've got our surgical hubs, over 100 of those opening. We've got our new hospitals
opening. But why
opening.
are you putting more in? I mean, in real terms, it's about half of 1%. Health economists saying you need to go to about 3.5% increase in real terms per year. You're nowhere near that. Why not?
Well, we are putting record levels of funding. If you look at mental health...
It's always a record, though, isn't it?
But it is, yeah.
Unless you cut funding, it's going to be a record every year.
But if you look at mental health, which I'm responsible for, we've got £2.3 billion extra a year going into opening up crisis centres, mental health ambulances, first responders, suicide prevention.
I'm not asking it. I'm saying, why aren't you putting more in? Why aren't you going up to this 3.5%?
But it's not just about how much you put in, it's what you do with it. And the fact is that we're putting it into frontline services. We've got our long-term workforce plan. We're putting it into staff. We're giving staff a pay rise. We're giving them career progression and training to develop staff so they can take on more roles, not just increase the number, but increase what they can do. So, it's a delicate balance. You can always put more money into the health service, but it's what you do with it that will make a difference. And we're starting to see that tide turning now in terms of waiting times and delivery, that when you've closed a system down for 2 years because of a pandemic, that will build a natural backlog that we're now starting to get through.
Do you think, looking back, that you mismanaged the negotiations ahead of strike action? Because you made reference, and you're right, of course, that has impacted waiting lists. But isn't there a parallel universe where you didn't go in hard, where Stephen Barclay didn't annoy people right at the start of this, you struck a deal and you don't have these issues?
Well, if you look at the million NHS staff we did do an early deal with, which includes nurses, they got a pay rise, they got terms and conditions, which meant that they stopped striking. We've just resolved a deal with the consultants. The junior doctors want 35%, and I think, you know, whichever political party you talk to recognises that 35% is not achievable. They're still on strike in Wales, for example, where Labour run the health service there. So, you know, with the vast majority of staff, we have done deals. People have called off strike action. It's just the junior doctors now. But that has an impact. That has an impact on waiting times and on performance.